Spinal muscular atrophy is a genetic condition where SMN1 is the gene affected. Because of that, survival motor neuron protein is not produced. This protein is needed for spinal nerves to function properly. The spinal nerves are from spinal cord to the muscles. If these nerves are not functioning properly, the muscles will go for wasting. This is called spinal muscular. In India, 1 in 8,000 is the frequency of spinal muscular atrophy. Various nations have reported from 1 in 6,000 to 1 in 10,000 live births. There are few types of spinal muscular atrophy from 0 to 4. 0 is a fetal onset, that is in utero itself. It is very, very rare and these babies will not survive. But the common one in pediatric age group, what we see is type 1 spinal muscular atrophy. The disease manifestation starts by around 3 months of age. So these children starts deteriorating, their movements of the limbs slow down, they won't attain motor milestones. Over a period, because of this muscle involvement, they may have respiratory muscle paralysis, and because of that, death may also can happen. There are other types also, like spinal muscular atrophy type 2, which can manifest little later. So from 9 months to 1.5 years is the age of onset, and type 3 in the childhood, and type 4 in adults. Yeah, these babies will be floppy. They'll be very, very fragile and floppy, hypotonic to handle. If they miss this warning sign, they can look for slowing down of the motor movements. The dancing movements of the babies will come down. The upper limb, lower limb movements will come down. Even if this goes missed, they will not miss the motor milestones. There will be delayed motor milestones. The head control will not be achieved properly. In spite of that, they'll be going for the pediatrician for regular checkups at 1.5 months, 2.5 months. All these while the pediatricians will also examine, so they may get some clue about spinal muscular atrophy. So we will examine the child. We will look for how the higher functions are, how the baby is, how alert the baby is. Spinal muscular atrophy babies will be very, very alert. They will recognize the surrounding. They'll cry for hunger. They'll be looking like normal baby as far as behavior is concerned. The only issue is with the muscles. So the movement of the limbs will be affected. Once we see that an alert child movements of muscles are less, we think of spinal muscular atrophy or some muscular dystrophies. We will do CPK levels, which will differentiate between muscular dystrophies and spinal muscular atrophy. There is a disease called Pompey's disease where there may be slowing down of the motor milestones. There we get a clue by echocardiogram where they may get some cardiac enlargement called cardiomyopathy. So initial steps will be examination of the baby, look for signs of spinal muscular atrophy, think of some differential diagnosis like muscular dystrophies, Pompey's disease, do CPK levels, then do an echo and find out which group this belongs to. Yeah, once we clinically suspect spinal muscular atrophy, the test to be ordered for spinal muscular atrophy is to look for deletion in SMN1 gene. So this deletion testing can be done by MLPA or QFPCR. Usually the MLPA is the better test, preferred test to be done, and we will take blood sample of the baby. We will subject to genetic testing called MLPA, where they will find out whether there is a deletion in SMN1 exon 7 and 8 regions. If this region is deleted, it confirms the diagnosis of spinal muscular atrophy. This deletion is found in 98 to 99% of the babies with spinal muscular atrophy. In some children where the clinical diagnosis is spinal muscular atrophy, but the genetic diagnosis MLPA is not yielding the testing, we will order for sequencing of SMN gene. So gene sequencing will be ordered, and we will pick up that 1 to 2% which is missed. Yeah. Previously, we had only supportive care as treatment for spinal muscular atrophies. So, supportive care is gentle physiotherapy, giving proper nutrition, avoiding aspirations, taking care of vaccinations, all these. So, but these supportive care can only slow down the disease a bit. It cannot stop the progression of the disease. Of late, we have got medications which are FDA approved for spinal muscular atrophy. So one is approved by DCGA of India also. So one is a oral medication called risdiplam. This costs around 40 to 50 lakhs per year. It has to be given lifelong. It is a oral medication. The next thing is injectable form through intraspinal injections. This is called Spinraza or nusinersen. This may cost around 1 crore per year. It has to be given lifelong. And the last one is the gene therapy, which is very famous drug known by everyone. That is 16 crore medication called Zolgensma. This can be given as a one shot, but again, this is too costly. Now the issue is we've got few medications, but the problem is the accessibility and affordability for these medications. Once this is freely accessible, freely, easily available for these families, then we can treat spinal muscular atrophy in a better way. Some families they try crowdfunding, they try charity, they go reach government, get some medications, but it is not accessible to all the patients. So in future, we are expecting that these medications will be accessible for most of the patients. Yeah, being a genetic disorder, this condition has 25% recurrences, and this cannot be identified by antenatal ultrasound. The antenatal ultrasound can only pick up structural abnormalities. This is an abnormality of the function of the muscle. This cannot be picked up antenatally. Once we confirm the genetic diagnosis in the baby who is affected, we will recheck the mutation in the parents. They will be carrying the reflection of this mutation. They are called carriers of the mutation. And confirming all these, we will advise the family to go ahead with the next pregnancy. So during pregnancy, at 12 weeks, chorionic villus sampling can be done, or at 16 weeks, amniocentesis can be done. These procedures will give us an access to fetal DNA. The fetal DNA will be taken, and genetic diagnosis will be made from the fetal DNA. If the fetus is found to be normal, the family can get reassured that baby is normal. It is in the 70% normal group, and they can continue the pregnancy. If the baby is affected, it falls in the 25%, then they have to take a call whether to continue the pregnancy or not because the baby is affected. This way, we can identify spinal muscular atrophy during pregnancy itself. There are other options like donor option or pre-implantation genetic diagnosis. These options have pros and cons, and this has to be discussed in detail personally with the genetic consultant or their obstetrician before deciding. Yeah, these children are prone for respiratory failure. The muscles not only in the limbs are involved, but the respiratory muscles also will be involved. Because of that, there will be pooling of secretions, pneumonias, respiratory infections, respiratory failure can happen over a period of time. They may get scoliosis, bending of spine because of the weakness. The gastric motility will be affected. They will have difficulty in swallowing or passing stools, causing constipation. So all these has to be taken care to improve the quality of life. So we need to form a team of doctors constituting a pediatric neurologist, a genetic consultant, rehabilitation consultant, pulmonologist, gastroenterologist. So then we will review these children according to their severity. Maybe a child is coping up well, we will review them 3 months once. If it is severe, we will review them frequently. But the whole team will manage these children as soon as possible. Once the clinical suspicion is there, it is better to refer them to us. Advantage is we will try and get the genetic diagnosis done. Once the genetic diagnosis is done without any further delay, so we can try initiating treatment in some ways possible. And most importantly, if there is a delay in genetic diagnosis, treatment also will be delayed. Because of that, irreversible muscle damage will happen. So we want to avoid that. So if they come early, do a genetic diagnosis early, we can try treating the babies as early as possible. Most important risk is if in case there is a delay in genetic diagnosis and the baby dies, we won't have any genetic diagnosis to prevent in the next pregnancy. It will be very, very difficult to test the fetus in the next pregnancy without this baby's genetic diagnosis is made. So as early as possible, they have to refer to us. Yeah. So role of the society is to have awareness about these disorders, detect early. There are some deviation in the developments of any child. They have to take medical attention. Most importantly, the society around the families with genetic disorders, particularly spinal muscular atrophy, should support these families morally, socially. They shouldn't stigmatize these families. That is very, very important. And there are parental support societies for spinal muscular atrophy. They are functioning very well. and these families, they group together, the parents, they group together, they discuss, they try and manage these children in a better way. So society's role is to create awareness, to support these families, and don't stigmatize. Thank you.